Hey, hello, welcome. I'm Dr. Philip Olmschneider at Ozark Chiropractic Clinic, and I'd like to welcome to our video today. Today we're going to be addressing a common complaint I see a lot of daily, and that's hip pain. Now, I'm not talking about the hip pain that where your thigh bone joins into the hip, you got that ball and socket joint. No, what we're going to talk about is the sacroiliac joint, or SI joint we call it for short. Now, I'll show you what we're talking about on our spine. Here it is. There's one here and here on each side. It's formed by the sacrum in the middle and each ilium on the side. That's why we call it sacroiliac, or SI. Now what happens when this joint gets out of alignment? It can rotate backwards, it can go forward, it can come in or out. And that's what's going to create the pain, the misalignment that causes the issues that you're going to feel. Now what happens, let's put this up here, is common complaint areas that you're going to see the pain at is you'll see it right along in the back on the upper part of the hip and the buttocks. It can even go down the rear into the thigh. You may feel a numbness or a tingle with it. It can wrap around the front into the thigh, into the groin area. Also goes across the belt line too. So those are some of the pain areas and the radiation that you'll feel when you're having that pain. Now, it responds very well to care. It's easily adjusted, and we see this really frequently. I did an x-ray. I want to show you a little bit extra too what we're looking at. Here we are looking at your spine from behind. This is the lower back, this is the hips. Here's your right side and the left. Now you can see the right hip is dramatically higher than the left hip is. So you rotate like that. And that's where the joint is out of line right here. And that's what caused the pain, either here or across the belt. And you can see that the spine even bows that way as a compensation, and that's very common. Often too, as you can see, here's the true hip bone right down here, that ball and socket joint. So you can see that when this joint's out of alignment, it can affect that joint also over time, but the knees, the ankles, and the feet. So it's tied in together and affects a lot more than just that one area. Now, they do respond well to care. We see it frequently. You get pretty dramatic relief when you adjust it. Some of the things you can do at home for it is, one thing when you first injure yourself, I always recommend, remember, ice. 20 minutes on, off for an hour. So that's good to do. Use it a few times. A couple of sleeping positions to help you rest a little bit better if you're having issues with the back, the hips, either way, is sleep on your back or your sides, avoid your stomach. And then always put a pillow between the legs if you sleep on your side, or put it underneath your knees if you're on your back. That helps take some of the strain off the hips and lower back. It may give you a little relief, so you can try those. And then there's an exercise I call the knee to chest stretch. And it's a very common exercise, simple to do, just like it sounds. Lay on your back, on the floor, or on the bed, whatever's easiest for you. And you're going to bring up one leg at a time like so. Hold it for a count of 5. Do each leg 5 to 10 times. And it's a very simple stretching exercise to do. If you're ever feeling leg pain occur while you're doing this exercise, I want you to stop. But generally, it shouldn't be a problem. So this is something to get checked, because as in any back problem, it affects your life and it affects your quality of life. You know, the longer the problem's there, you're going to find yourself not doing activities you like. It's going to interfere with your job, your life, and that's not worth it. So take this time to get yourself checked. Quit putting things off. They don't get better. They just get worse. So what we're going to do is, for our Facebook friends following us on the video, if you call in and say you saw our video, we're going to give you a discount, help with the initial cost of the fee, exam, and x-rays. So that's something we can do for you. If you have questions, call us at 479-667-5053. Always, again, share the video, like us on Facebook, check out our website, ozarkchiropractic.com. And then one last thing I want to share with you is we're doing a special event from February 20th through the 27th. We're having a food drive. And what we'll do during this week is, for any new patient who comes in, they can donate their canned goods, get their exam or x-rays for that donation, 2 can minimum, and this canned goods will go to the DHS food bank. Then on the Tuesday and Wednesday that week, our regular patients can come in for donate the canned goods, same thing, and get an adjustment. Our way of saying thank you to our people in the community and helping out a bit and giving back, because there's definitely always a need for that. So if you have questions, you can call 667-5053, but I want to thank you. I appreciate your time as always, and looking at our videos and sharing us and liking us. And until then, have a great day. Thank you.